Does my cat have a UTI? Watch for these symptoms. Imagine your cat suddenly changing how they go to the bathroom or acting uncomfortable during or after urinating. It can be confusing and worrying, but knowing what to look for helps a lot. Urinary tract infections in cats are common, but they are just one of many issues that can cause similar signs. A UTI is an infection caused by bacteria that affect the bladder and sometimes the urethra, which is the tube that carries urine out of the body. While UTIs happen in cats, they are less common than in dogs. Many cats with urinary symptoms might actually have other problems like bladder inflammation or crystals in the urine. Only a small number of cats with urinary issues truly have a bacterial infection. That's why seeing your veterinarian is so important for an accurate diagnosis. Some of the main signs of a UTI include frequent trips to the litter box, often with only small amounts of urine each time. Your cat might strain or seem to have trouble urinating, and they could cry out or appear in pain when they try. You might notice blood in the urine, which can look pink, red, or darker than usual. If your cat starts urinating outside the litter box, maybe in places like sinks or bathtubs, that's another warning sign. Excessive licking of the genital area can also indicate discomfort. You might smell a strong or unusual odor from their urine, or see other signs like lethargy, a decreased appetite, or even vomiting. In male cats, a urinary blockage is a serious emergency. If your male cat is straining to urinate but producing little or no urine at all, you need to get them to the vet immediately. This can be life-threatening because it blocks the flow of urine and can cause toxins to build up quickly. It's important to remember that these symptoms are not exclusive to UTIs. They can also be caused by other urinary problems like bladder stones or feline idiopathic cystitis, which is inflammation of the bladder with no clear cause. That's why your veterinarian will perform a physical exam, analyze a urine sample, and possibly do additional tests like urine culture or imaging to find out what's really going on. Getting an accurate diagnosis involves finding bacteria in the urine, which is done through a urinalysis and sometimes a urine culture. If bacteria are present, antibiotics are usually prescribed based on the culture results. If your cat keeps getting UTIs, your vet might look into underlying health issues that could be causing recurring infections. As a cat owner, keep an eye on your cat's litter box habits and note any changes. If you see any of these symptoms, contact your veterinarian right away. Early treatment can prevent more serious problems. Never try to treat a suspected UTI at home without veterinary guidance, because inappropriate treatment can make things worse. If your male cat is straining and not urinating, treat this as an emergency and seek care immediately. Supporting your cat's urinary health involves providing fresh water daily, keeping the litter box clean, and offering a balanced diet. Regular vet visits help catch issues early before they become serious. Remember, if you're asking yourself, does my cat have a UTI? The best step is to observe their behavior carefully and get professional help. UTIs are treatable, but only if diagnosed correctly. Always reach out to your veterinarian if you notice any changes in your cat's urination habits or overall health.